So when I first found out that we were having a lower extremity based class, I was very excited because I feel like my skills are very basic and that I can improve upon them. My strongest area is definitely the knee and the quad and hamstring and all the areas of the thigh because I've had a lot of cases of patients with those issues associated with those two places. I've dealt with quite a few ACL reconstructions and also just overuse injuries in runners and some issues with wrestlers and stuff like that. So I feel like the cases that I have dealt with have helped me understand more about those two areas of the lower extremity. I also had issues with my knees when I was in high school competing in sports, and so I had to go through an evaluation and rehab, and so I think that really helped me understand what the patients are going through as they work through lower extremity injuries. I also think that my weakest area are screening and prevention just in general of the entire lower body, because in my undergrad we really didn't focus on any screening at specific body parts. It was more of just like general health questions and screening. We also talked about prevention, but we never put it in place, and that really bothered me because I feel like it is on the athletic trainer to prevent injuries, and that is our job, because if we prevent the injuries, we are giving better patient-centered care because our patients are able to do what they like instead of sit out for injuries, hopefully. I can look at someone and tell you, oh, they have a larger Q angle, or their gait might predispose them for knee injuries, but I cannot tell you numerical values or qualitative values that would lead me to that and would like to develop or understand more of how to screen people for that. I want to learn more about the SI joint and pelvis and how to incorporate integrative healthcare techniques to take pain away or help fix pathologies with that. And I also would really love to learn more about IT syndrome and develop a rehabilitation plan for that. My initial thoughts about this class, like I said, is I was excited, like, let's go. I am expecting to learn new techniques and research ideas that I can implement into my practice so that I can be better about treating lower injuries. The biggest thing that I am worried about is that my undergrad class about lower injuries, lower extremity was a joke, and I feel like I taught myself, but I probably did not teach myself all that I need to. So I feel like I'm going to have to do an extra learning to get caught up with everybody. But I am looking forward to improving my knowledge so that I can be a better athletic trainer and provide for all injuries to the best of my ability instead of just kind of having the very basic skills. I don't want that. I want to have the best skills. So I would love to improve what I know now. Thank you.